Welcome everybody to our live Lift Up event. It's our 11th one, and Rosey Grant, my co-host, and I, we are back again. And this time we're talking about the very important topic of the formula to scaling innovation without losing the human touch. And we have got two phenomenal key speakers, both Rachel Lenington and Catherine Calarco, who is going to be joining us today. But before we pop them into the live event, we would obviously love to thank everybody for attending and joining us today. If you could pop into the comments and say hello, where you're dialing in from. But before I kind of get cracking through Rosey and I's introduction, for those of you that are completely new to the Lift Up community group, it's all about connecting, championing, and inspiring women across academia all the way through to C-suite within the life sciences industry. This group now has been going for almost a year. I think it was August of last year, wasn't it, Rosey?
Yeah, it's crazy.
Yeah, which has been phenomenal. So we've within Fraser Dove here, we've got a fantastic group of female ambassadors leveraging off of all the relationships they've got within the life sciences industry to really build this community group. And we're doing a live event every month, and we've had over 25,000 global views, and it's growing. So thank you so much for everybody that has been a part of this month in and month on. So yes, without further ado, I'm going to do a little introduction into myself for those of you that are completely new, and I'll pass this then over to Rosey to do the same. So
Yep.
I'm Louise Williams. I'm the Global Operations Director here at Fraser Dove, the Life Sciences Executive Search Talent Consultancy. I've been in staffing since 2015. I was headhunted into life sciences around 2014, so around nearly 10 years now, as a medical recruiter before moving into management director and now operations director here at Fraser Dove. I've got a 7-year-old girl and a 3-year-old boy that keep me very busy and hugely passionate about the life sciences industry. So that's a little bit about me, and now I'm going to pass it over to you, Rosey.
Yeah, brilliant. Thanks. Already there's so many people joining and saying hello. So we will come and say hello to some of
Wow.
you in just a moment. But from my side, I'll keep it quick. I've been at Fraser Dove for 3 years, work within the technical operations staffing space. But prior to that, had the pleasure of working in medical devices and getting my first taste for this life science world with some amazing female management, mentor, and coaches. So really passionate about creating a group where everyone can see a future in someone that's in a more senior position. But I'm actually going to jump straight into saying hello from some people. We've got people coming in from Italy. Hi, Gabriella. Welcome. Please let us know what it is you do, what function you work in, and how maybe you can be connecting with others. We've got Laurie coming in from Texas. It looks like we're fully global because we've also got Manul coming in from India as well. Welcome. I think there's a few familiar faces as well
Yeah.
as newcomers. We've got Didier coming in from France. Thank you and welcome. And yes, more people coming in, people saying hello. Hello from Canada here. But yeah, it's looking like we're going to have a very global crowd today, which is really exciting. Louise, I guess with everyone here, we'll go through a couple of the rules as we
Yes.
go in, not rules, but maybe expectations. As we go into the live Q&A, we tend to get quite a few questions coming from everyone. So please, to help us make sure we can get through as many questions as possible, put a Q in front of your question, and we'll note that you want us to bring it up with our live speakers. Talking of, maybe we should introduce them, Louise.
Yeah, absolutely. Thank you so much, Rosey. And it's really, really, I know I feel like I say this every time I'm logging into one of these live events, but it's truly phenomenal to see so many people dialing in all over the globe. And we can't wait for you to start getting your questions in so we can get you interacting with our key speakers as much as possible through the second half of this live event, which typically runs around 45 to 50 minutes. So I'm going to stop talking, going to bring in our first key speaker, and I'm going to bring in Rachel. Hello, Rachel. So lovely to have you here today. If you would be so kind to do an introduction to the audience.
Great. Thanks, Louise. Thanks, Rosey. Really excited to be here. Really excited to see everyone from all around the world. I'm already feeling energized. My name is Rachel Lenington. I'm currently the Chief Operating Officer at Athira Pharma. We're a company focused on developing new therapies for devastating neurodegenerative diseases like Alzheimer's and ALS. I've been in life sciences for 25 years. kind of amazing. Time goes fast. It feels like yesterday. But I'm truly passionate about product development and bringing innovation and new medicines to patients. I've had the real privilege of working for great companies such as Amgen, Seagen, and then I also had worked at the Bill and Melinda Gates Foundation. And so worked across different therapeutic areas and in different sort of versions of product development and what you're trying to do. And I just love it. Like, I think it's the best business in the world, because every day, no matter what job you have, and I started my career in IT, you are making a difference for patients, like coming in every single day. That's what you're trying to do. And that just really connected to my values. I started my career in change management. So some of the topics today are really relevant. And, and I'm a mom. I have 2 daughters, and I've been married also for 25 years. And so, so they keep me busy, but they're a little bit older, can drive, in college. So starting to see what life look like post having kids at home.
Yes, they're a bit more independent now, so yeah, I would like to say it's a little bit easier, but you probably don't stop worrying either way, no matter what age.
You never stop worrying. I had to text
Yeah.
her and say, I'm on this. Please don't call me.
Yeah. Oh, I love that. No, it's an absolute pleasure, Rachel. I know that, we here have known you for a good couple of years now, and it's been a pleasure working with you, and we're very grateful for you to be a part of this event today. So thank you. So I'm going to bring in Catherine as well. Catherine, we've had some excellent conversations over the last couple of months. We're delighted to have you here. If you would do an introduction to the audience, that would be lovely.
Oh, it's awesome to be here. I'm very excited about this conversation and really to participate in this wonderful group and community. I've worked globally at the intersection of humanity, innovation, and technology to really transform everything from organizations to introducing new technology to industries. And I wanted to basically infuse humanity into designing our future. So I've really been dedicated to being at that intersection across my career. And currently I'm a board member for AI and MedTech, helping to create point of care imaging for diagnostics. I've also been a CMO and VP at some of the leading companies in digital health and technology. I've led the growth and orchestrated exits at companies across the world. And I really agree, Rachel. Life sciences and healthcare is an exciting area because every day is purposeful. You are doing something that transforms someone's lives, and the innovation that we bring really does help people to have a better life themselves, to change their community and their families, and that impacts the whole world. So it really starts with the innovations that can transform the world, but also start with that one individual. So at Applied Biosystems and Biolab and Automation Anywhere, and in companies across HRV, stress management, which honestly we really need right now, and neurofeedback and AI for autism and robotics.
Yeah.
I'm really focused on that human-focused innovation and collaboration and high-performing teams, and building that trust that creates high-performing teams to create outcomes and scale that growth to the next level. And I have an excellent, an amazing family, but I also have a small dog that's my support system. And I'm a great lover of the ocean. So if there's any scuba divers out there, I'm a great explorer of the ocean. So I think that's important to embrace our whole lives as we invest in creating innovation for the world.
Yeah, wow, thank you. I mean, both are absolutely amazing introductions there, and the infusion of humanity. I can't even how you reeled off that whole sentence. Mind blowing. I'm going to need to capture. Well, this is recorded, right? We can share this. I'm going to go back over that moment, but that was lovely. That was really good, Rosey. We have got so many people dialing
Yeah,
in,
I
and
was just going to say I'll pull some people in because I think they've got a few more. We've got okay, they're moving quick. Okay,
I know.
we've got Reginald coming from Arizona in the US, as well as Libet Luce coming in from
Oh, hello,
New
Libet.
Jersey.
Yeah.
She's the one who we're working with, and also one of our previous speakers, Karen
Yes.
Millen,
Hi,
coming in
Karen.
from
Oh, great.
London. We've got different individuals coming. So we've got Jacqueline, and she's focused in asset leadership, development, and program and portfolio management. So a little bit similar to your background, Rachel. So I think it's going to be a really interesting conversation today.
Yeah, I can't keep up with them all. But thank you so much, everybody. Just keep them all coming, and hopefully get some questions in here as well as we move throughout. So I'm going to kick off the first question, which I feel like we always do this with our Lift Up lives, and it's always nice just to get your thoughts and feelings in regards to this. Rachel, I'll come to you now first. But why did you feel it was so important to be a part of the Lift Up community today and to join us live?
Thanks for the question. I think if you look at the statistics, right, it's a little bit sad in life sciences in terms of actually in many industries, but the relatively low representation of women, especially in the more senior ranks and the C-level. And I mean, I'm basically here because I want more women sitting around these tables. I want them, more women in boardrooms, more women in the C-suite, and more women in executive leadership, because we are really missing an important voice, an important perspective that can be brought in and diversify the perspective overall. And all of that, I mean, that is what drives innovation.
Yes.
Is diverse perspectives, interesting ideas, sparks of creativity of connecting dots you might not have seen. And without women in the room, we're missing that.
Yeah. No, thank you, Rachel. Couldn't agree more. I think the statistics that we were looking at the end of last year was something like, I think it was 7% of C-suite at bio companies globally were women. Which is pretty phenomenal. But Catherine, I'll come to you with the same question. Why did you feel it was important to be a part?
Absolutely. To build on that, it's not only the C-suite, it's the dropout that occurs in the mid-career. How do we re-engage women into it? Life sciences is attractive to women from their natural interests and capabilities. And I started out as a biochemist, and I love science, and I've always encouraged women across the years to be part of this. So as part of How Women Lead and Astia, we embrace engaging women to take on leadership roles, to participate in creating our future and having the courage and bravery to enter in the arena. And I think it's important for us to support each other. So Lift Up Community provides a mechanism for us to connect with each other, to champion each other, and to advocate, support their voice, and create connections that help each other to jump to that next level. And I think it's incumbent on all of us to participate on that. And so I want to be a voice in that positive change. And I think the Lift Up community offers a wonderful way for us to collaborate, connect, and to really champion each other without engaging in the mean girl activities. This is really about next level leadership is pulling a chair up to the table and inviting someone to sit next.
100%. Yeah. Sorry, Rosey,
I was going to say, I really agree. It starts at the top, middle, and bottom. I think there's a leaky bucket on every level when it comes to women in science and the healthcare industry. But
definitely for those that are experienced, and like you said, it's dropping down that ladder, isn't it, to the next level of generation to support them and their growth. And I think this group so far has demonstrated the ability to champion and support each other. So it's great to have you a part of it. So thank you very much. I'm going to dive into our first question now, which is very on topic related. So as leaders in life sciences, how do you define scaling innovation without losing the human touch? I think this is a cracker to get started with. So Rachel, if I can come to you perhaps first with this question.
Yeah, no, I view that question as really, it's about growth and development, right? I care deeply about innovation, and it takes many forms. And I think, we can talk a lot about that. Innovation is just not a new scientific discovery or a new product. It can be a new and evolved process. It can be a new way of thinking. And this idea of scaling innovation, you can't do any of this. There is no innovation and there's no scale without people. So it's pretty simple. And it's really, it's the people who are all sitting here on this call, who are joining in this conversation. You're bringing your passion, your talents to create innovation at all levels. When you think about our industry, it's really about the patients and caregivers who are looking for new things to improve their lives or extend their lives. And it's just, it's not possible. And so you have to grow. And I think this leaky bucket idea and this idea that
Yeah.
you want to be bringing people along, to me, innovation doesn't come and people don't come. It doesn't happen without the growth and development of individuals, and making sure that, whether you're a new college graduate or have been in your career a long time, that there's always a place to learn, grow, and have ambition and goals that will take you to the next step, whether it just be learning something new, learning a new industry, or honing your skills.
Yeah, completely agree.
Yeah, 100%.
Okay, let's come to you, Catherine, with the same question.
Yeah, I completely agree. It's more around the, that what is innovation, and a lot of times people think innovation is something big and transformative, AI, but in fact it can be simply automating one of your tasks so that you create 10% more hours in your day. So I think that when you innovate and keep the human touch, it's about infusing empathy and building trust as a fundamental to high performing teams. So that enables them to execute with excellence. And I think that it's up to leadership to set the vision of what the innovation can do and have the perseverance and authenticity to actually work with the individuals to assure that they are supported to achieve that outcome. And so that's really about, the processes that you use, communication, and letting the best of the team emerge in the process. And that means being inclusive and adaptive, et cetera. So I just think with right now, with the speed of change that we're having to deal with, it's unprecedented. And the impact of things like the pandemic and the climate change, and climate change is healthcare. So the two of them are very interrelated. So I think that we're going to need never before seen innovations or adoptions like we saw during the pandemic of digital transformation. We're going to need to keep that going in order for us to truly realize and the innovation or the success of organizations and people moving forward. So I think it's the integrating soft skills as a core fundamental to the process for innovation, but also being real, being who we
I
are.
like that. The integration
real.
of the 100%. The integration of the soft skills, actually, absolutely. When you said that, resonated with me, because innovation isn't just a process. There are kind of many pillars that sit around scaling for innovation, but a big part of that, apart from change management and processes, is about culture. It's about values. It's about people. It's about how they operate, their superpowers, their strengths.
Right.
So, if you're thinking about scaling for innovation, you're thinking about all of the pillars. Like, one of the fundamental pillars, right, are, as you were saying, Rachel, is people, and using their superpowers to scale that change
I was going to
management process.
say, taking into account everything you've all said, I think scaling innovation without losing the human touch is about not forgetting your why. There's a reason that you are innovating the process, the products, it's because of the people. You're either making your employee's life easier or a patient's life easier through what you're innovating. So as long as you're not forgetting the why you're doing it, I think you can scale it at a great pace without losing the human nature to what you're doing.
Well, and I was gonna say that it's also this idea of sort of engaging people's heads and their hearts, right? You have to inspire, and part of that is thinking about the why. And I mean, we are lucky in this industry because it's very easy to be inspired by what we're all trying to do. But sometimes you have to find that inspiration, if you're making a process change at the organization or setting, something a little bit more mundane, you still need to help people understand the why and enroll them in this and seek the diverse perspective, because you can't make change without wide adoption and scale.
Definitely. And Franz has said, I think Franz is coming in from Switzerland today, and he said, great question and great answers. So I think we're on the right path. But I think it's interesting, kind of going on from that, there's obviously, our industry is, as you know, known for groundbreaking discoveries. And it'd be interesting to hear, what key change management or processes work best in your experiences, let's say, for successfully implementing that new innovation. We'll come to you first, Catherine.
Yeah, I think it's, what's interesting is, just to build on the topic before, is that when we're faced with this need to be adaptive and agile and build resilient organizations, and have the goals and numbers that we want to reach, as well as bring along the heart and inspire and understand the why. P.S. I love Simon Sinek. So I think that a lot of the methodologies have really not changed much. And the best one that works is often the one that works for you in your situation. So you might have a process or a methodology that you've already started, Six Sigma or at Adapt or Cotter or any of the other ones that Agile that you've used. And it's really about how can you optimize that, or what is not working or what is working, and what do you keep and what do you change. And I think that it has to, you have to relook at things like ethics and the emergence of AI, and how do you adopt that within the process to improvement. And so I think it is about knowing what works within your organization, keeping curious about what is new and how to optimize what you have, and infusing the requirements for leadership and for the teams to actually achieve execution on that. So I honestly believe that life sciences has always been very innovative. I mean, I was at Applied Biosystems, and we were creating the DNA testing and the whole innovation within separation instrumentation, et cetera. And we saw led that hyper growth within that time. This was 30 years ago, so we've always automated, we've always made efficient labs, we've always looked for ways of making things more evident. And I think it's now time to take it into maybe some of the other areas of healthcare, like, for example, the whole system itself, or making patients not have to fill out 9 million forms with the same information. I mean, there are opportunities to take that forward and adapt the methodologies that work for the needs of the future, and be brave enough to make those changes.
I mean, that's a great answer, Catherine. But if we're talking about the change, I feel like post the pandemic, if we're taking into consideration the more remote working, the challenges sometimes maintaining that human interaction and touch. Plus, there's the whole factor, I'd say, that we're more conscious globally now than ever around diversification of whether ethnicity, gender, because the more diverse input panels, individuals, people you've got, then hopefully the more broader coverage you've got. Rachel, you were alluding to this earlier, but Rachel, you've got 25 years in life sciences. On the back of what Catherine's just said, how do you feel in maybe the last 3 to 5 years? What changes have you seen to perhaps the way in which innovation is being processed or reviewed?
It's been interesting because, as Catherine said, the pace of change continues to move exponentially. Actually, the pace of discovery in life sciences and the understanding and the ways in which you can actually, stop or interdict in a disease have really changed. But there's so much coming at us all the time, and there's so much I think people take for granted. I mean, in the 90s, I worked in one of the big 6 consulting firms back then, and I actually worked at Microsoft, but I was a consultant doing change management, training and change management for the implementation of a software system that was not Microsoft's, right? And we did all this work to understand how does the new system fit into people's jobs and train them and do all these things. And it was very careful and it was very specific. And now it's like, you get a new app, figure it out, do this, do that, and so I think there's an expectation. I think there's some change management principles that are exactly the same, but they've kind of been lost because we're so used to getting a new, update on our phones, and all of a sudden the phone works differently, and we're just expected to figure it out.
Yes.
And so I think sometimes in business, what I'm seeing, and in the pandemic context with all of us on Zoom, you just sort of expect, people will just figure it out. But actually, a key principle, and Catherine alluded to this, is communication. You cannot over communicate the why, the plans. But the problem is we're so inundated with information, it's easy to miss. And so back to our title of this talk, the human touch. You can't underestimate the power of having conversations live, right?
Mhm.
You know, not just sending the email, not just sending the text, or not just the Slack or whatever. You actually have to have a conversation. You have to open the door. You have to create room for questions so people can understand how it's going to affect them.
Yeah, I completely agree. The rapid requirement for organizations to adapt to what happened during the pandemic is a learning lesson for us all on how to adapt to anything, really. And the key part of that is, how do you retain that human connection that's necessary to stay productive? You know, how do you create virtual environments that are inclusive, that all voices can be heard and they feel safe to communicate?
Yes.
You know, and you can communicate numbers and make hard decisions and drive things forward. But you've got to bring the two along. And I think it takes individual growth and innovation within yourself. And it takes a different type of leadership to modulate how do you actually create virtual connection. It's a different thing. And I do agree with Rachel on the getting in person is important. You know, and having an opportunity to really know each other, you know, and communicate those goals and make it real for people, you know. So anyway, I think this is a fascinating time to figure out this puzzle that is in itself innovation.
Yeah, no, I absolutely agree. And actually something you've said on is just floated in a question from me, but just want to put it out there to the audience, because we've got some great interaction still happening here on the comments side that I'm just wanted to enter into. So, you know, Franz, again, thanks for your comment. Hi, Catherine. I agree that we need to stay curious in our life. I love the curious element to what you said there. In addition, it is very important to apply common sense approach 100%. And we've got lots of other people dialing in. What I would just say to the audience, you know, if you've got questions now that are burning and you'd love to get them involved into the comments that, you know, Rosey can pull out to both Rachel and Catherine, and just pop in a Q at the beginning of your sentence, just so it's easy for us to navigate, as we previously said. But just talking about some of those examples, Catherine and Rachel, so, you know, both of you board C-suite level now in the businesses that you're in, and both of you have really helped innovate and scale the companies that you've been a part of. You know, so through your experiences, you know, what examples would you perhaps give that where you've implemented a process, or you've created an initiative, or whether it's to maintain that human touch, that it's gone well and it's been successful? And Rachel, I'll come to you actually this time.
All right. Well, I would say that you know, I've had the privilege of working on getting multiple drugs approved and over the finish line, right? You can work your whole career in life sciences and be an amazing leader, an amazing scientist, and actually not have the privilege of working on a drug that gets actually across the finish line, because this is hard and we have high failure rates. And so part of innovation, to bringing innovation to market, is how you work as a team and how you collaborate and how you build that cross-functional interaction. Because you know, I will tell you, product development is a team sport. I think we all know that. And there's not one function or one individual that can make that happen. And so you have to create a system, an actual system that engages those leaders. And so I've done that at multiple companies, and it's made a real difference. And I love the example at Seagen, or Seattle Genetics, was in 2015. The company had one product. It was a really important product in lymphoma. And you fast forward to where we are today in 2023, and I think they have 4 or 5 products approved at this point, and actually making a tremendous difference for cancer patients. Mm-hmm. That system took a lot of change to build, a lot of engagement across the board, and is something that, you know, the teams that I worked with, and I'm really proud of the work we did, because I think it's enabled a lot of that. There's lots of factors to it, but you do have to create really systematic ways of approaching this very hard problem.
Yeah, and keeping the communication tight. And the same question comes to you then, Catherine.
Yeah, this is a great question, because I think from examples we learn what works and how to lead and pursue persevere through challenges. And I just, Rachel has done some amazing work globally. And I just a salute to the impact that the organizations have made. I think the examples, and I've got several because I've worked in for the Prime Minister of New Zealand and helping to change the country with regard to thinking broader and growing an IT industry and running, getting people running. I was a CEO of a digital marketplace and was commercial operations for a company, BioLab, which is now owned by Thermo Fisher. And we really went through a doubling of our growth, and we're the first to launch an e-procurement. So the first time someone used the internet was to buy a product off of our portal. so think about what goes through a procurement person to actually embrace technology and find that, oh my gosh, this is fantastic. So I think it is about that human touch and understanding what making something work for your customers, incorporating what is what they need and understanding from their perspective. Rachel touched on that diverse input, the stakeholder and getting their input to make it work, and that product management is a team sport. I think that's super important to understand that the team includes your customer. And you have and listening to the diverse views of globally. Not every country is the same. So having that conversation and almost building it in concert with them to make it work so that something they've never done before becomes an everyday task. And I think that's awesome and fantastic. And, then I think just recently with the pandemic, we were automating intelligent automation across life sciences industries to really rapidly provide innovation to help them deal with the overwhelm that was happening, and to be able to enable them to find raw materials so they can sustain manufacturing, for them to understand how to manage the supply chain and continue to continuity of supply. So little things that we did to automate work so that they could deal with the volume overload was phenomenal. I mean, one example, you look at companies like Novartis and Becton Dickinson, and they had tremendous success for how they innovated across their organization to do digital transformation and optimize not only just the drug discovery, but also the supply side. And one example, and this is public, is that they had orders coming in at a regular rate, and overnight, the amount of requirement for personal protection equipment was 5 times. It's not humanly possible to automate that. It's just not. They would take them a week. Now imagine the impact on lives. Now this is super boring stuff, right?
It's a great example though, but yeah.
But you think about the human impact of doing that was tremendous. And not only could they automate this process, it wasn't humanly possibly to do, but they also were able to distribute across many, so that one distributor didn't end up with all the supply.
Yeah.
So you allowed enough across. So I think it's the holistic view of understanding the problem, knowing what the customers need, and then what tools do we have, and how can we get the Tiger team together to figure this out quickly.
And the blend of automation and systems and digital equipment versus the human side. Sometimes there is just that, well, actually, if you want what's best for the patient and it means volume and means getting it out in that way, then you're going to need to use some of these automated processes, so it's just the blend, isn't it?
Yes, and it makes people's lives easier. If they can go home on a Friday and not have to spend the entire weekend processing things, their lives are better. They'll want to work at your company. And I think that, we know about and then within biofeedback and digital health, we established the #1 stress management device and outpaced the sales of Fitbit in the beginning, before they got $170 million, and we transformed 5 million lives worldwide. I mean, we literally help people manage the response to stress, and we did that with a small team and a very little budget, and really just by vision, perseverance, and knowing what to do, and knowing what you have works. You can succeed to create a global impact. You don't have to be big to change the world.
Yeah.
Anyway, those are just a few. And
Yeah, I'm trying to think of how we can summarize. I think ultimately what I guess I'm, it's communication, it's the strategy, it's the human touch, it's the blend of the right digital equipment, automation platforms. It's quite a lot there, isn't it? But I
yeah,
think, it's hats off to you both, though, both
Hopefully, at
tremendous.
least if we do one of them right, we can get some sort of
Yeah.
process happening. I actually want to highlight this question that's come in from
Oh, okay.
Roman. So obviously, innovation teams are often meant to be the force that helps to break functional silos in organizations. What would you consider warning signs of the innovation teams um, that is leaning to become yet another silo?
oh wow, good question.
That is a good question.
Rachel, we'll come to you first, Rachel.
So I think we've kind of gotten at this a bit. It's about really thinking about the end user and where you want to go. So I'm going to flip the question around is not what are the warning signs, but a way to avoid becoming yet another functional silo. Because you're right, these cross-functional teams are intended to break those silos down, and sometimes they can become a force in and of themselves. I think you need to be thinking about the target product profile, the patient, the audience, and then within the organization, you also have to think about where this team, where is its place, what is the context of the organization, and making sure you're not, that you're keeping all those inputs open, right?
Mhm.
You need all the information, and then you need to synthesize it and talk about it. And I think when you get too inner focused and not with your eyes open to the
Blinkered. Mm.
to the environment, you really do run a risk of that happening.
Yeah, definitely. I feel like it's um, the key word is implementation. It's meant to evolve and kind of blend into what's already going on to make it easier, not this or that. And that is what can sometimes create that tension, I think, as well. Well, Catherine, I'll send the question your way. What are your thoughts on this?
Yeah, to build on this, I think this is where leadership needs to keep visibility, right? So you need to, as a CEO or as on the board or as in your CIO, needs to understand this challenge. And if the team is spending more time in Confluence creating pages than they are executing results, then maybe there's a silo. So I think the I think if you are recognizing it, there needs to be a forum to have the conversation about it. So at the Automation Anywhere, we had a Helios change management leadership team that operated as a champion group around the organization to help facilitate initiatives that were innovations, both internally and externally, to help create a positive shift to manage the hyper growth we were going through from. And I think there is an opportunity to, do you have a cross-functional team that operates as a steward to help champion these initiatives for you and helps keep that fresh conversation going between groups. And also, is your process becoming the rigor that's forcing the silo? And so how do you actually, this comes back to one of my favorites, Clay Christensen, which is the innovator's dilemma. Does the organization, how does it disintermediate itself? How does it allow innovation to occur so it doesn't stagnate and die or get disintermediated? Now, innovation teams can be part of that by allowing mavericks, allowing people to be different, to allow that diversity of voice, or allow a forum for that discussion, and be able to make mistakes and make those changes. So I think, and life sciences is good at creating an innovation pipeline that's allow the market to innovate for them, and then they buy or corporate partner or things like that to bring that innovation in based on their strategic goals and how they want to grow their organization. So I think those are a few ideas, and hopefully that helps, Roman.
Yeah, thank you, Catherine. Roman, what a brilliant question. I think you got some great responses there. So
Yeah.
hopefully some good takeaways. So thank you. Keep the questions coming through as well. we've got, I think Paolo, unfortunately, he's had to dive off into another call. But just to let everybody know that this will be shared, obviously, this recording afterwards. So you're 100%, you will be able to see this. We've got Labette here as well, just relating to an earlier, I think, response was Catherine, Rachel couldn't agree more. We need to maintain the human touch to generate questions and innovation, especially for those persons just beginning their careers. Couldn't agree more. Fully virtual and or email exchanges are not optimal. Yes, you need the diversity there, don't you?
We've just had another question come in.
Yeah.
That actually looks quite good. And I think the way that we should think about this question is the customer being any kind of stakeholder, whether it's an external actual customer or a customer within your business, right, as you are implementing this change. And it's obviously in the pursuit of scaling innovation. How can organizations strike a balance between leveraging advanced technologies while maintaining, and I want to stress this, the next word, authenticity of human interactions? So this could be like an automated process, like you were saying with the procurement piece, Catherine.
Yeah.
But how do you keep that authenticity throughout the customer journey?
Wow.
I'll send
Yeah,
send
that's a
it
big
to
question.
Catherine.
You'll send it to Catherine. So, okay, this is my superpower.
And we've got 5 minutes.
A LinkedIn user connect with me via LinkedIn and let's have a conversation about this. I think this is not easy. And I think it starts with who you are as a person and the team that you have working with you, right? And I think it takes true leadership to figure out when to push, when to pull, when, like you have to be, it's very situational. And you have to have things that work for the customer to begin with. And you have to be authentic yourself. Customers have to trust you to make this work. And you got to be smart about how you take them through that journey. And you have to, it's not just about a bunch of slideware. It's about what do I do and how do I adapt that to really make it work? And how do I build stakeholder alignment and understanding? And you can't make a customer really do anything. You have to tap into what they need, what their motivation is, how they adopt things. There's a lot of things that go around that. And I think that's where all the human connectedness and your clarity and communication and how you make your product works, et cetera. So I'm super interested in who asked this question. I have some ideas, but I'm more than willing to spend some extra time talking about this because this is a really good one and really important for SaaS companies and very important for where life sciences and healthcare is going. This is probably one of the biggest issues in terms of getting innovation to truly change healthcare. This is probably one of the biggest issues.
Yeah.
You can't make nurses talk to robots, people.
I love it. I know. And for this individual, what's basically happened is they got their security privacy settings turned off. Sometimes people aren't even aware that that is an option, but you can go into your settings to take it off if need be. Rachel, I'm not sure if there's anything that you'd like to add to that, perhaps.
I think that was
it's
well.
Ivana.
Ivana, call me. Let's chat.
Oh, she's got here now. Sorry for the big question, but this session is so insightful. So I thought the right platform to ask.
Awesome.
Yeah, no, thank you. Oh no, we've got some we've got some fabulous ones coming through, but I'm very conscious of the time. One that I'm probably going to come to just before we start wrapping up was one that I did see in here around the scaling side. Scaling is regarded the last step after the discovery, the proof of concept, the piloting of innovation. So, for both of you, what do you feel are perhaps the biggest challenges that just to be aware of, I guess, if you're embarking upon that journey?
So I will say, it all comes back to the individual. Catherine just made the comment, you can't have nurses talk to robots, but to scale, it means individual people have to make change and change the way that they're engaging or leverage the innovation. And, in my work at the Gates Foundation and in global health, big goals, eradicate malaria, eradicate polio. Where that actually happens is in the health clinics where that's happening, in the villages where that is happening. And what I was so impressed with in that work was just the leadership, the vision, the incredible, amazing skills that you see in individuals, sitting in remote places, making change in their community for their health. And I think that's true of all of this. It happens with an individual person, and you have to connect to those people, and you have to help them understand why. Mm-hmm. And you have to answer the hard questions. You can't shy away from that. You have to deal with the conflict. But at the end of the day, it's all about individuals.
Yeah, couldn't agree more. And Catherine, is there anything that you'd like to add to that?
Yeah, no, I completely agree, Rachel. It's the endpoint, and it's the people that are executing along the way. And I think the only thing I would add is, are your processes supporting to make it easier? Are they hindering? Are you not making decisions you need to make that allow people to move forward? I think one of the key things is to make a decision with either way too much information or not enough. Mm-hmm. So you've got to be able to test to fail, and also find a way to figure out how to move forward. So I think it is education and communication and constant learning. And then it's leadership skills associated with making those decisions and giving people the confidence to step across that bridge.
Yeah. Oh, I love that.
Sure.
Really good. And we're going to wrap up with something, because we're kind of approaching the end, and it always gets to this point. And Rosey,
but we do always ask
cram
this
it all.
Yeah, we always ask this question to everyone, so it's really important.
Yep, absolutely. So looking back on your successful careers, what advice would you give your younger self if you're embarking upon that, journey again from the beginning? So, Catherine, I'll come to you first with this question.
Yeah, I know the question is intended to provide some sort of insight associated to what would help people right now, right?
100%. Yeah. So inspiring the younger, perhaps, generation.
Yeah, exactly. The world is so different to my younger self than it is now. And I've had to change so much that I think if I went back, I might do something very similar. I'd look at her, I'd say, hi, give her a big hug and say, I love you. No, I'm serious. Don't we need more love in the world right now? And I know this as a board director, you're probably going, that's a little soft. But I think reality wise is that, courage, to be courage and drive growth, you have to be willing to embrace the humanness of us right now. And so I would go back to my younger self and say, you got it, girl. Just go for it. Just go for it. You got it. Step into that arena. You can do it. Yeah. Not about, there's 100 choices I would have done differently, mistakes I would have avoided, but that's part of learning, and that's part of life. So I think the biggest thing I can say is to people right now is that just give yourself a big old hug, put on your big old girl pants, and step into the arena. Just go for it. We need you all right now. We need your light. You need your who you are for who you really are, all of you. And your awesomeness, because you're all awesome, or we wouldn't be alive right now.
I feel like we need a big group hug session.
Yeah.
and we've got this. We've got it. We know how to do it together. We're going to make it happen, and we're going to figure this out. And step by step, we're going to have it happen. So I know that's a long answer, but I wanted to say, I wanted to inspire people to be involved.
Yeah, we can consolidate. Yeah, growth, hug, love. Yeah, really like that. Thank you so much, Catherine. And Rachel, obviously the same question to you. How would you summarize?
Well, I actually, there's similar themes here, but one of what I am glad to know now is that your career is not a straight line, and there's going to be opportunities, and there's going to be forks in the road, and you don't want to look back with regret, right? And so, and I think the other piece of advice I'd give myself is really don't limit, like there's self-limiting thoughts. You put constraints on yourself, and tell yourself a different story. Take the constraints out and ask yourself, if I wasn't afraid, what would I do? Or if I didn't think I had these limitations, challenge yourself on what you think are the limitations. One of the best pieces of advice I ever got was from my husband when we were facing this opportunity, and I was leaving. I remember where I was standing in our house, and he said, Rachel, the only person holding you back is you.
Yeah.
And yeah, he's a good sport guy.
Does he still remind you of that?
He does. Yes.
They do.
Yeah.
Oh
So,
no, I love that.
um,
Great bits of advice. No, that's absolutely true. And it's been, I don't know, we might need to do some form of a collage or something, I feel, Rosey, because it's almost like we've asked this question at the end and we're approaching our year, 12-month anniversary, I
Don't
want to
ruin the
call it.
surprise. There's
I know.
something in the
Oh, I
works.
don't know. I don't even know what the strategy for that is, but yeah, it's just
I
there's
know that
been
marketing
such
are on
great.
that.
Oh, brilliant. Well, there's been such great responses to these questions. It's really humbling. But look, I want to thank you so much for taking the time today out of your really busy schedules. And I appreciate 100% why you've done it. And it's all for the greater good of this community, which we really appreciate. And naturally want to thank everybody in the audience for joining us today and for everybody's questions and for getting involved. We've got the link here to the Lift Up community page. I think I'm reading all this off. Rosey, do you normally do this bit? I feel like am I
Honestly, we
have
kind
I
of go
just
hand in
jumped?
hand these days.
We're
But
blending. But yeah, so we've got the community group, haven't we, live? We've got the membership group as well, Rosey, which is, over 100 members now. But, we'd love to just see you part of this group. If you're not included already, get involved. We share all of the latest content on when the next lives are coming up, and some great inspiring comments as well from all of the members that sit within it. And for now, I think that's pretty much it, isn't it?
yeah, it is. Thank
Wow,
you
it's a
again,
wrap.
everyone.
Okay. Well, yes,
yeah,
thank you
so
so
much.
much. Thanks for
Thank you
joining
very
in.
much.
Enjoy, whether it's morning, afternoon, or evening, wherever it is you're dialing in from. Have a fabulous rest of your day. Thank you so much and take care. Bye bye.
Bye.